Welcome to 50 Plus in Montgomery County, a monthly program that is a voice for many and produced by the Commission on Aging, of which I'm a community member. This show is insightful for people of all ages, and each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie Smith. On this month's show, we will learn about the African American Health Program in Montgomery County. Joining me is Arlie Wallace. Arlie is the program manager for the African American Health Program. Hi, Arlie.
Good morning.
How are you?
I'm doing well, thank you.
Arlie, you've been on this show before, but I want you to tell us about the African American Health Program, also known as AAHP. Talk about the background and what you do.
Katie, I do want to thank you all again for inviting us to be a part of the show. The African American Health Program was put in existence back in 1998 after a meeting with County Health Department staff with then Secretary David Satcher from Health and Human Services, who was advocating and putting out the Healthy People 2010. What happened was on that morning at a county staff meeting, the nurses from Public Health Services, along with our health officer, which was Dr. Garvey at that time, heard about the alarming statistics that was based on infant death and maternal health issues, along with HIV/AIDS. After that meeting, those nurses and Dr. Garvey went away, started planning, had a couple of focus group meetings with the community at large, internal meetings, and they decided that they had to put together a program. That program was called the African American Health Initiative Program. That took place in 1998. It took them over a year to really get it together. And then the county executive during that time, which was Doug Duncan, funded for the first time the African American Health Initiative. So that program since 1998 has really bloomed into focusing more than just maternal and infant health and HIV/AIDS. Today, it focuses on everything from oral health, cancer, diabetes. And now we have also embroached into the area of mental health. And those services are all being provided by an external vendor on which the county works with on basically a daily basis.
And what do you do, Arlie?
Oh, well, I guess my job is not the fun part of it. It really focused on the whole administrative piece. So I'm the monitor of not only the chronic disease contract, which we have that external vendor for AAHP, we also have a small community grant. And then when we receive other type of grants, I monitor and deal with all the administrative aspect of it, the negotiation, posting it, monthly reporting, any changes that may be necessarily with their budgets. So that is my day-to-day job. Then I also I have the privilege now to finally have staff, and you'll meet two of them this afternoon as well. So now we have expanded our services to do more type of work. And then which means now I do evaluation. I have timesheets, leave, and all the other things that are not fun, but it makes the African American Health Program definitely much better.
Well, I'm looking forward to meeting your additional staffers. Now, from the African American Health Initiative to now the African American Health Program, tell me, what is your mission and who do you serve?
The mission of our program is to really improve the quality of life for Africans, African Americans, as well as Caribbean American residents of Montgomery County. And that's our true mission. And we really want to make that life better, or at least equal to our other colleagues and residents of Montgomery County.
Now, how do you help to make that mission, as well as that vision, a reality?
Yeah, a lot of the time we have to really stay on the ground and looking at research, what data has to say about the current health disparities, because it tends to change. And that's why I've shared with you the other things that we got involved with. Because as we saw the greater need of mental health, I put together and was able to get those fundings for that services put in motion. So in looking at the existing data that exists, when data is publicized, or what we hear from the community at large, the Black community, we can then incorporate, make some modification, and implement different type of activities and services in the county by talking to those who we serve, which is the Black community.
Now, as you're implementing those activities and services, how are you raising awareness in Montgomery County about key health disparities?
Well, we can raise the health disparities by like today's social media outlet, right? We typically have, over the last recent years, going back almost maybe 4 years now, we have started putting together a summit that focuses on whatever is on the mind of the community or what we feel as the program need to be amplified. This past, I guess now 2023, in November, we actually held a summit that focused on Alzheimer's, because Alzheimer's has influenced and impacted the Black community at a much, much earlier age. And we know, based on science and medicine, that is due to the chronic disease that Blacks have been plagued with for so many years.
Hmm. Now, as you know, Arlie, Black History Month is in conjunction with American Heart Month. Many Black people are disproportionately impacted by some form of cardiovascular disease. How is AAHP addressing barriers to health equity, including structural racism, social factors that hurt people's health, and threats to rural health?
Okay. We are doing it by really having our services that are tailored to the various type of Black community in Montgomery County. The way in which we really have tried to address the whole issue with structural racism is that I go across the board and try to talk to and have communication with our individuals who are in housing, in education. I've even been involved with law enforcement, because structural racism exists in a system, whether or not people believe it, accept it or not. And you actually see it based on the fact how some services are designed to exclude people who need it the most from being a part of it. Most county services, minus the African American Health Program, the way in which we're going to continue to try to defend that structural racism is that we're not going to look at one's income. All other services, or the majority of services in which the county actually offers, is based on one's income. And as Blacks, income has nothing to do with our sickness. We can be the most wealthiest Black and still have cardiovascular disease, or we can be the poorest Black. It has no degree based upon one's socioeconomic. So that structural racism is how we're focusing it, is always allowing all Blacks to come a part of it, and even others. We'll provide the service to anyone who would come, but we tailor it to what the Black community, because of that huge disparities gap that has been historically in Montgomery County and nationally. Mm-hmm. So what we are still, and we will continue to do, is try to focus that, talk to our other colleagues when we hear about legislation that we know is going to also influence a more wider health gap. We will try our best to influence those legislatures to change that particular bill, or to make sure that the services that we're bringing in, to try to make sure that it can open it up more and not have so many limit and restrictions based on one's social income.
Arlie, I have about 1 minute left, probably 30 seconds.
Okay.
But I definitely want to ask you this question as we wrap. Does AHP have a newsletter? And if so, how do we sign up to stay in contact? I know people would love to hear more about your summit and then other tailored programs that you have.
Yes, we do indeed have a newsletter. It can be accessed through our website address, which is AAHP Montgomery County .org. Or you can even call our office main number, which is 240-777-1833.
Arlie, thank you so much for talking to me today.
You are welcome. Thank you, Katie.
Up next is Monique Gardner. Monique is the aging coordinator for the African American Health Program. Welcome back to 50 Plus in Montgomery County. Joining me is Monique Gardner. Monique is the aging coordinator for the African American Health Program. Hi, Monique.
Hi, everyone.
Monique, tell us about AAHP's Aging Subcommittee.
Yeah, absolutely. So the subcommittee, the aging subcommittee, It was actually founded about 4.5 years ago by two of the chairs. So one of the co-chairs is actually Mr. Arthur Williams, who is a commissioner on the Commission of Aging. He's also an executive member of the African American Health Program. And the other co-chair is Mr. James Stowe, who actually happens to be the director for the Office of Human Rights for Montgomery County. And so those two wanted to connect and really address the prolonged history of Montgomery County not meeting the needs of the Black aging population within the county. So the subcommittee brings together a collective of county professionals, residents, churches, and just other stakeholders to share knowledge, resources, and event information.
So what sorts of resources do you offer for older adults?
Okay, yes. So actually, we have a computer access technology training. And so we get senior or junior high school students from Montgomery County Public Schools, and they actually train these elders on how to navigate their technological devices from cell phones to tablets to laptops. So we do some intergenerational computer training. We also have the Alzheimer's Summit and the Alzheimer's Post-Summit activities. We actually offer a toolkit on how to manage your Alzheimer's and dementia, whether you're a caregiver or a family member, or, someone in the aging community that is suspects, you may have some signs of early on stage Alzheimer's and or dementia.
Well, for the aging subcommittee, who are some of your community partners?
Oh yeah, sure. I'd like to give special shout outs to my 5 main community partners, that being my active senior, hi Shamem. I'd like to give a shout out to the White Oak Senior Center, Tiana Abraham, the East County Senior Village, hello Miss Sylvia Saunders, the Aging and Disability Resource Unit, hey Ayana, and the Smithsonian Institute, which has partnered with AHP to do tailored on-site programming to the African American residential facilities in Montgomery County, as well as the Black Physicians Healthcare Network.
And what types of virtual program and classes do you offer for older adults?
Yeah, so we do have some online courses dedicated to Zumba, Tai Chi, and also we have chronic disease management courses, as well as a new 5-week mindfulness series that is headed up by Kimberly Johnson, program specialist at African American Health Program as well.
How can someone Monique get involved with the aging subcommittee?
Yeah, so all they have to do is they can call our office number, email me at monique.gardner@montgomerycountymd.gov. They can call my office phone number, 240-773-0349. And I'll make sure that they're in the email loop, and we'll be getting out correspondences to them regarding the meetings. Our aging subcommittee meetings are every first Tuesday of every month.
Monique, I have about 1 minute left. As you know, it's Black History Month, and that's a time for honoring and reflecting on the hard work and accomplishments of those in the Black community. Can you share some of the accomplishments of the aging subcommittee and the work being done in Montgomery County?
Yeah, sure. So we did have an Alzheimer's Summit last fall in November, and we had a post-summit activity just this past 2 weeks. It was a free screening of a film called Forgetting Christmas by Cadell Cook, and it was actually focused on raising awareness for Alzheimer's in the African American community and what that actually looks like in a film. So that was a free event we did, and it was a great turnout. We also are partnering with the CME program, which is from the Smithsonian Institute, and we're doing our 2nd series of on-site culturally competent and culturally tailored programming for African American seniors that are in residential facilities in Montgomery County. So last year it was dedicated around food and hymnals and quilting, and this year it's going to be focused on jazz, instrumentation, and Black stories.
Well, Monique, thanks so much for joining me as we continue the conversation about the African American Health Program and learning specifically in our conversation about the Aging Subcommittee. I appreciate having you on.
Thank you guys. Happy Black History Month.
Up next is Dr. Ikena Myers. Dr. Myers is the Clinical Program Manager for the African American Health Program. Welcome back to 50 Plus in Montgomery County. Joining me is Dr. Ikena Myers. Dr. Myers is the Clinical Program Manager for the African American Health Program. Hi, Dr. Myers.
Good afternoon. Thank you for having me.
I'm glad you're on. Let's jump right in. Dr. Myers, what are some of the services and programs that you offer at AAHP?
Well, we really center around health prevention and education and addressing health disparities among African Americans. We offer health education classes on a variety of chronic diseases disproportionately affecting the African American community, such as diabetes and hypertension and cancer. We have accreditations from the CDC and offer diabetes prevention program, pre-diabetes classes, as well as diabetes self-management classes as well. As far as prevention, we offer health screenings at different locations throughout the community to have their glucose, A1C, blood pressure, BMI, cholesterol, as well as referrals to primary care providers of color when people don't have a medical home. We do HIV and AIDS, as well as sexually transmitted infection screenings are available, and we do have nurse case management to address disparities in maternal and infant mortality among pregnant Black women, mothers, and children.
Now, Dr. Myers, what are the major health areas that you focus on?
Well, AHP focuses on 6 major health areas. I believe I mentioned a couple: maternal and child health, diabetes and heart health, cancer, oral health, mental health, which is really important, STI, HIV, AIDS. And our services include outreach, health education, I mentioned, support groups, nurse case management. And the program is staffed by a wide range of healthcare professionals, including registered nurses, mental health professionals, health educators, and community outreach personnel.
Now, tell us a little bit more about your geographic hotspots and the initiative that AAHP has.
Well, thank you for asking. For more than a decade, Montgomery County has been one of the wealthiest counties in the United States and ranks one of the 2 richest counties in Maryland. However, the wealth ranking does not commensurate with the disparities that exist in death and disease conditions among its population subgroups in Montgomery counties, particularly among its Black population. Well, in 2017, to address this disparity, Montgomery County and the Office of Community Affairs, and especially the African American Health Program, published a solicitation to identify the zip codes and the levels of health disparities within those zip codes. The result was a solicitation that produced the Health Disparities Hotspots Identification Initiative to identify geographical hotspots within the county where severe racial disparities in health outcomes existed, where services for the Black population can be improved to address these unmet needs. The primary goal was to address disparities in 6 areas: cancer, cardiovascular disease, diabetes, HIV, STIs, maternal infant care, oral health, and other cross-cutting areas. Mental health, I believe.
Dr. Myers, are there is there any specific data rather that you can share about Montgomery County related to those different areas that you just talked about?
Yes, absolutely. Well, one that's really important is maternal morbidity among first-time mothers shows that Black mothers suffer from diabetes almost 5 times more than white mothers. Black residents in certain zip codes, such as 20901 Silver Spring, are admitted to hospitals and emergency room visits for hypertension almost 40 times and 9 times more than whites, respectively. ER visits for type 2 diabetes are almost 8 times more among Blacks than whites. In certain zip codes, Blacks had a 42 to 70-fold greater diagnosis of chlamydia and 22-fold disparity in gonorrhea in Montgomery Village. And hospital admissions due to colorectal, cervical, breast cancer among Blacks are more than 2 to 3 times higher in certain areas of Gaithersburg, Silver Spring, and 9 times greater and 5.5 times greater in certain areas in Silver Spring than whites.
Wow, Dr. Myers, those statistics are startling. But let's take our time with this next question that I'm getting ready to ask you. Black Americans still experience health disparities, and you mentioned some of those disparities in their healthcare and in many other areas due to environmental and social factors. But that also calls, our attention during Black History Month, makes us more aware. Can you talk about some of those disparities and maybe chronic diseases? You mentioned before diabetes, cardiovascular disease, and cancer. Can you talk about that a little bit more in detail?
Yeah, so a lot of the unfair and unjust differences in the social determinants of health. So we're talking about things like economics, living and working conditions, things that play a part in our every day-to-day lives, the places, where we live, for a lot of people of color, inner city environments, the air we breathe, which may be also inner cities, that make some of our environments a lot less healthy to live in, all play a part in increasing the disparities in health that we have, increasing the amount of chronic diseases that we may suffer from as African Americans, as well as other ethnic populations. So the African American Health Program really works towards addressing those disparities, as well as addressing some of those social determinants of health and working conditions, and giving people the support that they need to improve their outcomes, improve equitability, and addressing those social determinants of health, and progressing towards health equity, a stage in which every person has the fair and just opportunity to attain the highest level of health. When it comes to African Americans, we're 1.8 more times likely to have diabetes across the nation, 50% more likely to develop hypertension, and 3 times more likely to develop and suffer from kidney disease. 2.5 more likely to suffer from lower limb amputations. And so I could continue on, but the statistics speak for themselves.
Wow. You also mentioned earlier men's health as well as mental health as focus areas for AAHP. Is there anything further that you would like to share about those two programs?
Yes, we currently have an amazing collaboration with the Housing Opportunities Commission to provide men's health classes to men who have mothers, girlfriends, or wives, or children with housing vouchers, and we are looking for other future collaborators to increase our participation of Black men in our programs. We also have a really, really great meditation and mindfulness class. I believe Monique mentioned that occurs quarterly, taught by Miss Kimberly Johnson.
Hmm. And I've asked the other two guests who also work at AAHP about Black History Month. And so during this month, it's important to celebrate the contributions of Black Americans as community catalysts. Tell us, how is AAHP's commitment to equity? How does that create opportunities for a healthy life for everyone?
Well, I believe, it's our mission. It's in the mission to reduce and eliminate health disparities by creating health awareness through education, primary and secondary prevention, through screenings and referrals to healthcare providers who look like us, to provide medical homes. And so through that, we're literally creating a continuum of health from the time someone's screened all the way through the time someone sees a physician. And the African American Health Program, and addressing those disparities, is creating a safe space for African Americans to improve their health, from the time that they learn about their disease all the way through the time that they are healed.
Now, are there any events that you're having during February that you would like to highlight for our guests? Any specific events that AHP is hosting?
Well, I would really encourage that they visit our website, AAHP Montgomery and look at the calendar. We do have some really great monthly classes that I believe I mentioned earlier for chronic disease, as well as the nutrition classes on Tuesday, I believe. We do have a walking group that comes every other week on Saturdays, and healthy cooking demonstrations on, I believe, on Thursdays. So I just, I really encourage everyone to please visit the website, take part in the virtual classes, as well as the in-person walking group and our other great programming.
Dr. Myers, if anyone wants to stay in contact with you directly, how can they do that?
Absolutely. They can reach me via email at my first name, Ikenna, IKENNA, Myers, MYERS, at montgomerycountymd.gov. And they can also reach me at my work line at 240-777-1701.
Well, Dr. Myers, thank you so much for coming on and sharing with us today.
Well, thank you for having us.
Absolutely. Well, that concludes our program for today. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for seniors in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County. Happy Black History Month.